Okay, I'm a little delirious. I'm on hour 12, hour 11 of my shift. It is now nighttime. But what drives me insane is when well-meaning healthcare providers who are not versed in lactation, which 99.9% it's that way and it's not their fault, but they don't talk to us. They don't call up a lactation consultant to get our opinion. And when I have a patient who's put on a medication like Bactrim, i.e. TMP, SMX, or sulfamethazole trimethorphan, say that fast 5 times, it is safe to breastfeed. But I have moms who come and they're pumping and dumping their milk because they were told it was not safe for their baby to breastfeed. But their baby's full term, their baby is several weeks old, their baby has no known health issues, and there is a Bible that we have that all providers, doctors, nurses, everyone has access to. It is called Thomas Hale's Medications in Mother's Milk. It's very expensive, but I have one because the hospital paid for it. So there's many principles, pharmacokinetics, fancy pharmacist terms for how to determine safety of things. One of them, here, this is one of the many key points, but if the relative infant dose is less than 10%, most medications are considered relatively safe to use, and it depends on the type of medication. If you open the book to page 608, we can see sulfamethazole trimethorphan, i.e. Bactrim. It's limited data, probably compatible. So we don't have a ton of research because in the US, it is not allowed to do research on pregnant lactating mothers or infants as it should be. We should not be experimenting on these people, and we're not. So there's not a shit ton of research, obviously. And it talks about all these different mathy things and science, chemistry things about how it gets in the breast milk and how much the baby gets. There's ways you can mitigate any risks with it if you are concerned. And the relative infant dose is 4 to 9%, i.e. it says, in lay terms, it says multiple times in this mother effing book that it's safe in a baby like the one I just let out the door with the loving mom who was pumping and dumping her milk for 2 whole mother weeks because they told her she cannot give it to the baby. And I'm not going to spend my time contradicting anything and confusing everybody. I'm just like, great, sure. And it's heartbreaking, of course. Like, it hurts to throw away your milk, right? And the baby doesn't get all the good stuff, like the antibodies. Formula is great. Glad we have it. But why needlessly stop breastfeeding? That's my concern. There's no point. Thank you for listening to my rant. Good night.